Leading better value care is about the patient as part of the decision-making process and to inform them on the problem, what can be done to help, supporting the patient to more effectively manage their osteoarthritis.
The spectrum from early disease to late disease, there is this whole area in the middle which is not managed in a very consistent manner. And so we certainly saw a need and value in trying to produce a service to give patients the ability to access good, consistent care to get optimum function, and all of a sudden you get a patient who's got a painful minor arthritic knee to a painless minor arthritic knee. So in terms of the arthritis, that hasn't changed, but their function is dramatically improved.
I was quite enthusiastic from the outset for several reasons. One is obviously I could see the patient benefit and the clinical benefit to patients, but also the integrated care really appeals to me, the idea of actually GPs and the primary health network and the LHD and specialists and hospitals actually working together to get a result and communicating with each other. It's undoubtedly the way that medicine should be moving to.
In the past, management of these issues has been mostly symptomatic. Often would only try pain relief, and if that didn't work, then possibly referral to an orthopaedic surgeon to discuss joint replacement surgery. But we now know there's a lot of other options without going down the line of joint replacement surgery too soon, or without giving other options a trial first.
We started this program as a pilot, trying to really identify, well, is this something that we can improve in this space, become both an effective service that will provide a lot of value for the community, as well as minimise specialist intervention in early phase, but it really wasn't required.
Sometimes communication is the best way to get simple changes like this, simple but effective changes across the line.
Well, I've had problems with the knees for many years. I'm not able to walk really well, and I was also taking a fair bit of medication for the pain. I refused to have an operation, and I wanted to be able to stay in my own home. And so we had to look for other options, and this seemed like a good one.
Everything was sort of getting worse. Then I started falling, or my knees would give way. That was horrifying, because until you've lost confidence in something you take for granted, like walking, you don't know how inhibitive that can be. And now I don't need walking sticks. I am confident, but my legs are doing the work.
Of the patients that have been through the program so far, 2 out of 3 have reported that their pain has improved, or their knee or hip function to have improved, and 2 out of 3 have reported that their walking has improved.
Anecdotally from my patients, I'd say at least probably 3 out of 5 of my patients have avoided or declined surgery, gone away from the surgery path.
I have so much to thank the program for. How do you say thank you when something's given you your freedom, your confidence, your life back?